Welcome to Mountain Stream TV. Today is August 22nd, 2025. I'm Ron Arps. Today we have another interview in our series we're calling the Community Preservation Forum. And what we're doing in this series of interviews is talking to people from various nonprofit organizations and government agencies to get information about programs that they have for people in our community to assist them in various things like health, nutrition, education, and housing. Another thing we'll talk about is the effects that the government changes at the federal level in regard to staffing and grants and funding are having on our local agencies and organizations. Today we have Clarissa Ashe from the Department of Public Health of Jackson County. She's a deputy, I can't remember it. You can edit this out. Deputy Health Director. And she's been in the health department for 20 years, so she has a lot of experience in our community. Welcome, Clarissa.
Thank you, Ron. Thank you for having me.
And thank you for coming.
Mm-hmm.
I guess we'd like to start out with you can tell us a little bit about yourself and about the mission of the health department,
Mm-hmm.
and then we can get into some more specifics about the programs and how people can get access to them.
Okay, perfect. So, like you mentioned, my name is Clarissa Ashe. I'm the Deputy Health Director for the Jackson County Department of Public Health. I've been working with this agency for 20 years now. Public health is every day, everywhere, everyone. So I am completely just public health nerd is what I like to call myself. Our mission at the Jackson County Department of Public Health is to enhance, ensure, promote, and protect the health of the residents through prevention and education. And what else did you ask me? I'm sorry. I get a little nervous sometimes.
Yeah, we all do. This is my first time at being an interviewer, too. So
Okay.
we're kind of in the same boat. Well, what I am interested in is the programs that you have that directly affect the sort of average person in the community. And I noticed that there were several things on the web page. You have a clinic, there's a WIC program, there's health education, and I really didn't know, which of those are the main thing, if there is a main thing that the health department does. So I guess if you can tell us about, say, what most people who come to the health department are looking for when they come there.
So we offer a variety of services, and we're either known for our clinic services or we're known for our environmental health services. So I love this question because, like I said earlier, we're every day, everywhere, everyone. I'll start with environmental health. Environmental health is where you go to apply for well and septic permits when you're building a home, or if you're wanting to expand or improve your current home. We also have registered specialists that go out and inspect food establishments, tattoo parlors, pools. We have animal control under the health department in Jackson County. It's not like that in every county, but here we do. We are responsible for animal control, and that's adoption, if there's any complaints.
And there's a new shelter right?
Yes, we're very pleased with that shelter. It's a beautiful, it's a beautiful shelter. If you haven't been, I encourage you to go. There's always cats and dogs, you know, that need a good home. Let's see. So I touched on that. Health education is big for us too. Like I mentioned earlier, it's not just about prevention, but it's also about education, the work that we do. We have health education specialists that go into the schools and talk about adolescent pregnancy prevention. We also have Healthy Carolinians. It's a committee that comes together and decides like different initiatives that they want to work on in the community. Like for example, a wellness program, Elevate 828, that's available for community members to participate in.
And what would they be doing in that?
It's a wellness program, so they do a lot of like nutrition, like exercise programs, just different things that people who are interested in that can enroll in. It's like a 6-month program that you just kind of you go through and hopefully come out at the end with a better knowledge about nutrition, wellness, exercise, and things of that nature.
Mm-hmm. Is there any eligibility requirement or any fee for that?
No. If you go on our website, you can see the different screening events that they will be having. It starts, I believe, in October. And like I said, it's a 6 months program, and you go in there, sign up. There's like different times that you come together, maybe like to weigh and things like that.
Mm-hmm. And does that meet at the health department building?
There's various places that they go. I know that the school, Jackson County Public Schools, participate in it as well, like the staff.
Mm-hmm.
So there's just different outreach areas that our health educators will go and provide that service.
Okay, tell me the name of that particular program again.
Elevate 828.
Elevate 828.
Mm-hmm.
Okay. That should be easy to remember with
Yes.
the 828 area code.
Mm-hmm. Mm-hmm.
All right.
Okay, so I talked about environmental health, I talked about health education. We also have a WIC program, you mentioned that earlier, and that's Women, Infant, and Children Nutrition Program. That is based on eligibility, and there are requirements of age, so any child under the age of 5, and of course pregnant moms, to receive a supplement nutritional package during the time of their pregnancy, and like I said, up to age 5.
Mm-hmm.
Mm-hmm.
Okay. I'll just comment, when I had first moved to Jackson County, my wife and I had an 18-month-old,
Mm-hmm.
and we were very poor at the time. We really depended on the WIC program.
Mm-hmm.
We couldn't qualify for food stamps because which food stamps rather than SNAP at that time.
Right.
Because we had a car.
Yeah,
But
unfortunately, there's different gaps and different requirements, but the WIC program is just amazing. I can't say enough about it. When I first started, you would receive vouchers. I'm sure you remember,
I remember that. Yep.
The paper vouchers that you would have to take with you to the grocery store. Well, now you get like a little card, kind of like a little debit card, where your benefits are uploaded to. They have made it really user-friendly. You also can do this service now over the phone. I mean, there are times that you have to come in, like especially children, to get weighed and stuff to continue on the program. But I mean, our WIC staff, we have such a dedicated staff. They've been there, some of them have been there close to 30 years. So they go above and beyond every day for our community.
And like the things that you can get through the WIC program has expanded over the years.
Yes.
It used to be just like, I remember milk and cheese and maybe juice, but there are a lot more things.
Yes, they've expanded to fruits and vegetables as well now. I mean, if you think about it, it's a supplement to SNAP if you qualify for that. But like you said, a lot of people don't qualify for both.
Mm-hmm. And I do a lot of grocery shopping in our family, so I see those little tags all over the place in the
Yes.
store that say WIC eligible.
Mm-hmm.
So it makes it easy to find the stuff that you can get through the program.
Yes.
That's great. The easier things are, the better.
The better. Absolutely. One less thing to worry about.
Okay, so let's see. What about clinical services?
Our clinic is another one, like all those other services that I mentioned. Most of the time people don't know that they're housed in the health department. Some people just know us for our clinical services, which is immunizations, family planning, maternal health, adult health, STI clinics. We also try to do a lot of outreach, especially around flu season. Right before school starts, we just participated in the back to school bash with the school system as well, provided immunizations there for school aged children. But those are like appointment based services that we do offer Monday through Friday as well.
Mm-hmm. Just talking about immunizations, are those requirements for school children the same as they have been, or are there any changes to that?
So, you do hear a lot of stuff in the media regarding immunizations and some of the services that we offer, but nothing has translated into practice yet. So we're still offering the services like we normally do. And obviously, the immunization schedule is a recommendation. I mean, it's not something that, the parent gets to choose that. Now, obviously, of course, in public health, we highly suggest that you get those, but none of that has changed just yet for us.
So I'm so old. When I was growing up, I got measles, I got chicken pox, I got whooping cough. I ran the whole gamut, and I don't recommend it to anybody. Much better to get a little poke in the arm.
Yes. That is definitely what we strive for. Like I said, I mean, it's about prevention. If we can prevent, a child from, being severely sick with whooping cough or the measles, polio is a thing of the past.
I got mumps too.
Oh yeah. All very painful things, right?
Yeah. Not an enjoyable time in my life.
I talked a little bit about adult health. We also offer worksite wellness for a lot of local businesses, and that includes blood work screening for their employees, as well as CDL physicals if that's something that is required for their job, pre-employment drug screenings, things like that. We also, in our clinic, do sports physicals, school health assessments. I'm trying to think of BSEP, which is our breast and cervical cancer control program. That is a program that has, different requirements based on income, eligibility, and insurance and stuff like that. But it is a great program for women to get their mammogram screening annually.
So do all of these programs have different eligibility requirements, or is there sort of a standard for like income or?
Yes, they all do. They all come with different requirements. Like for instance, BSEP, the program that I just mentioned, you have to be a certain age, maybe different risk factors. Also, your household income is taken into consideration. Immunizations is the same way. We do have Vaccine for Children program, and that is for children under the age of 18 who do not have insurance or underinsured. They can come to the health department and get those immunizations for free. Otherwise, if you have insurance, we can bill your insurance for those same immunizations.
Okay, a quick question about that. Listening to the news, I heard that the CDC was no longer recommending like COVID vaccinations for, I think it was infants and pregnant women. Is that something that has affected your program?
No. So again, like I mentioned earlier, you know, these are recommendations for, you know, you to decide yourself on if that's something that you want to have administered. And you know, we continue educating, you know, pregnant ladies and children, you know, that, you know, we have this immunization, you know, it's up to you if you want to actually receive it. But we still have them in our building.
And does what the CDC says have any effect on insurance, if you have insurance?
We haven't seen any of those changes. I'm sure it's a possibility, you know, because insurance, you know, you have to, it has to be covered under your health plan that you have with insurance, but we haven't seen any of those changes.
And that definitely varies with everybody's
Yeah, and there's so many
insurance.
Different insurances.
Right.
Yeah.
Yeah. I'm a believer in single provider health insurance myself, but
Yeah.
maybe someday.
Maybe someday.
It would sure make life a lot
Yes,
simpler.
yes, for sure, for sure.
What else do I have on this list? You probably talked about public health preparedness a little bit.
Yeah, so that's another service that we offer. We are very fortunate here in Jackson County to have incredible local partners. We partner all the time with Harris EMS, Jackson County Emergency Management. We meet quarterly to discuss different plans, whether it be, you know, evacuation plans, like with Hurricane Helene last fall, or just in any kind of emergency that you can think of, really. It could be natural disaster, it could be pandemic. I'm trying to think of other ones that there's a lot of them.
Yeah, I'm sure.
But yes, we are heavy in preparedness. We I lost my train of thought.
It's always hard to remember everything,
Please.
isn't it?
I hope you can edit that because I totally just lost my train of thought. So
We're pretty informal.
Okay.
And we like to hear you laugh.
Well, I like to laugh a lot, so. So with preparedness, you know, we have an EPI team. We also have an LEPC. We're heavy in acronyms. I'm sorry. But we like to be prepared for anything that comes our way. Of course, you know, with COVID a few years back, we weren't. I don't think anybody was prepared for that, but we came out better. We learned a lot from it, and we continue to practice those response efforts.
I heard just yesterday that COVID is on the rise again in Jackson County, like coinciding with the start of school and college and people coming back from everywhere. And so that's something people should be aware of right now.
Yes, and we're actually gearing up to offer outreach events for the seasonal flu. Of course, COVID, whenever that comes about, we don't have the COVID vaccine in our building yet, but we will continue to offer those services for anybody who is looking for that. We do go into the community, but we also do a drive-through clinic in October. Every Tuesday in October, we will be offering the flu vaccine from 1:30 to 6 p.m. And then also we'll go out into the community and offer those for anybody who's interested in receiving them.
About the COVID strain, is this a new variant? Do you have any information about that? And is it I know in the past, new variants have tended to be less life-threatening, but more contagious.
I don't have specifics, but you explained it very well. You know, when you have been vaccinated for something, you know, you're how do I explain it? There's immunity to that disease. So yes, like the flu, COVID, you know, they all have different variants every year. But the vaccine is put in place for the one that is more likely to affect us. You know, when we first saw COVID, you know, we didn't have a vaccine, we didn't have anything preventative. But now that, you know, that has been in place, we have seen, you know, less deaths, you know, as it was like 5 years ago. So yes, there will be, I don't know what variant we're looking at this year, but it'll be, the vaccine will be tailored for whatever they're seeing currently.
And that'll be available in a month or so, probably?
We typically start receiving that in October.
October.
Mm-hmm.
Okay, that's a good thing to
Yes.
keep in mind.
Mm-hmm.
And I've been getting RSV vaccines and flu vaccines. Are those updated every year, and so that there would be a new one coming out at about the same time?
The flu vaccine for sure. I'm not sure about RSV, how that one, if that one has to change, you know. I mean, typically the MMR, the varicella, polio, all that, you know, I mean, we receive those from the state, and then of course from our vendors that we purchase from. But I don't think those change annually.
Okay.
Don't quote me on that. I'm not.
So is the government still subsidizing the COVID vaccine? I mean, if people come into the health department, they can get it for free, basically? Or?
No, it hasn't been for free since, it's been a few years ago now. I mean, we built insurance for it. When the pandemic happened, yes, we were offering those for free to anybody. And we also offered flu vaccine just because we didn't want people to get, you know, the flu and COVID. But as of right now, we haven't seen any denials in any of the immunizations that we are billing for.
Okay, and the list of fees is on the website,
Mhm.
right? And just to bring that out, what is the information? Well, the website is
health.jacksonnc.org.
okay. Health.jackson.
jacksonnc.org.
Okay. Health.jacksonnc.org.
Correct.
All right.
Yes. And the fees that you'll see on there are for folks who are self-pay. So if you have insurance, I mean, that doesn't apply to you because like I said, we can bill your insurance.
Mm-hmm. Okay, and anybody can come to the health department whether they're insured or not.
Correct.
And then you just work out all the details.
Mm-hmm. Mm-hmm. Mm-hmm.
That's good.
Yes. Yeah, we're bound by HIPAA. You know, we can't share any personal information.
Mm-hmm.
So that is all something that we collect during registration.
Mm-hmm. Okay. I'll check my list here. I think you've covered everything that I have on my list. Oh, there was one thing, case management. It was a child-oriented case management service.
Yes, we have SimHarp and CMark. I wish I could remember what they stood for.
Yeah, there are too many of them.
Yes, but there are too many acronyms for sure. But yes, so those also, like CMark is case management for children.
Mm-hmm.
So we have a social worker that will work with a family for children under 5, and then SimHarp is for children over 5 and also pregnant women. And they're kind of like a navigator. You know, they help them, you know, with resources, like the CMark social worker is involved with diaper distribution as well. She partners with Babies Need Bottoms. So that's a service that folks can come to the health department as well. I mean, they have to call her and she tracks all that information, but that is also a service that is offered to the community.
Mm-hmm. Yeah, I had never heard about that one, so that's good.
Yes.
And so that would kind of work with WIC,
Mm-hmm.
and
Yeah, they're actually housed in the same little suite.
okay. I wish when my wife and I were first starting our family, we had services like this. It would have been such a help to us.
Yes, yes. You know, everybody needs a little help sometimes, you know, and we're just here as a wraparound service. There's a lot of things that we don't offer, like housing and transportation and things like that. Those are a big need in Jackson County as well, but we know what resources are available and who we can refer folks to.
Well, that's an important service also.
Yes. Mm-hmm.
So we during the course of organizing these interviews, we've come across a lot of groups that we had no idea about, or I personally didn't.
Right, right.
And it's kind of hard to, if you don't have a little clue to start out with, you know, even with the internet and all, it's still hard to find.
It is. It's very hard to navigate. And I will say that we pride ourselves here at the health department when we conduct interviews for our registration staff at the front. You know, I always let them know that we kind of are a resource hub as well. I mean, it's not just the services that we provide, but, you know, people will come in, they'll call, and like you said, have no idea exactly who they need to contact. But we make sure to have a list of resources and know where people can go to.
So they wouldn't actually have to come in and apply for anything. You could just come in for information. That's great.
Yeah. Yeah. We're here as a resource.
Okay.
I did want to share a couple events that we have coming up.
Oh, good.
So this weekend, actually, at Bridge Park, our substance use prevention coordinator is working with Rally for Recovery, and that's Sunday at Bridge Park from 5 to 6. I have a little flyer here if you would like to keep that. It's just Overdose Awareness Day.
Hold that up.
Let me zoom in on that.
Got it?
Yep.
All right. People can stop the video on YouTube and get all that information right off.
Technology is wonderful sometimes, isn't it? And then we also have coming up in September, Prostate Awareness Month is in September. So we will be hosting a prostate blood screening event at Innovation Station. So we hope to get a good crowd of...
I don't know if I can see the dates on that. Can you tell
Yes, it's September 3rd at Innovation Station in Dillsboro from 5 to 7 p.m. And we're partnering with the Great Smokies Health Foundation in order to provide this event.
Great.
Can you talk a little bit more about the funding of the health department, where your money comes from, and if you're aware of any impact from the pending federal budget cuts that are
Yeah, absolutely. So we are very fortunate here in Jackson County. We are local government. So we are Jackson County employees, and the health department is an entity of Jackson County. But the way our funding is we receive federal and state dollars for the services that we provide. And there has been federal cuts. I mean, you've heard about it in the news, but the way that we receive our allocations is through the state. So the state of North Carolina is actually distributing the funds for the specific programs that we offer. And again, North Carolina is awesome because they're trying to reallocate the money that they receive in order for all counties to be able to continue to offer the services that we do.
And
then locally too, we're also funded by Jackson County, taxpayer dollars.
And I guess the federal funding changes at the end of September. Is that right? The new fiscal year starts.
Correct.
So that will be one of the times, at least, when there would be changes happening.
The way we're set up is, like I said, we're local government, so our budget is approved by Jackson County Board of Commissioners, and it's done per fiscal year. So our fiscal year is July 1 through June 30th. So I don't foresee us really seeing any changes. If there's any changes funding wise, not until next fiscal year. We might have to adjust our budgets then, but as far as this year's concerned, we're not really looking. I mean, we have heard from the state, that a funding source may be delayed, but we also hear that we're still expected to receive it. So
that's always good news.
Yes.
In full.
Yes.
Yeah, we sort of heard that from Cooperative Extension also.
Yes.
That what they had heard was that there could be some minor changes, but not significant for the next year or so.
Yeah, and that's it's very important to be in the know and stay educated, because we do hear a lot of things in the media, and I think sometimes, it causes a lot of panic, but at the end of the day, we just have to, nothing really has impacted our services yet.
Okay. And then I just thought about somebody who's coming in who wants to apply for some service. What kind of documentation would it be helpful for them to have to fill out an application or, to get started?
So for our clinical services and for WIC, we always ask for like legal name, so an ID of some sort. If they have insurance, of course, a copy of their insurance card. We don't typically require, some places you go to, they want to see like a bill or something with your name on it. We don't really have any of those stipulations to, in order to receive our services.
And if there's an income requirement?
It's self-declaration. Yeah.
Okay, so you don't necessarily have to have a check stub or something like that from your employer?
Not for the clinical services. I think you do for WIC, but if you qualify for Medicaid, I think you automatically qualify for WIC.
Okay. That's good to know that there's some consistency.
Yes.
Okay. Is there anything else you'd like for people to know about public health?
Just that we're awesome and that we're here for you, all of you.
And what was that nice phrase you had about everyone, everywhere?
Every day.
Every day, okay.
Yes.
Public health is here for everyone, everywhere, every day.
Every day.
Good.
We're often invisible until something bad happens, but we're always here.
Right on. Okay, thank you very much for coming in today. It's been fun.
Thank you so much. Thank you so much for having me. And
you have a lot of information that you've given to people.
Awesome.